Hello everyone, welcome to my YouTube channel. Today's topic is cervical cancer. Then we'll also explore the Pap smear, which is done to confirm the diagnosis. Then we'll also talk about staging of the cancer. All right, we will focus more on this image. Most of the things that I'll tell you about will be based on this image, which is showing all the parts that are mostly affected by the cervical cancer. All right, if you look here on the picture, this is the cervix. This is the cervix, and when a person is already having cervical cancer or this cancer, they will develop this, but this is now became a tumor. So before we continue, let's talk about it. What is the cervical cancer? The word says itself. Cervical means that it's cervix. Cancer is this development of the mutation of cells. So cervical cancer begins when healthy cells in the cervix develop changes, and these changes we call them mutation. So the healthy cells will start to have this abnormal mutation in their DNA. So this will affect the DNA of the cells. Remember that the normal body cell, they develop and they die in a certain period, then the new ones develop again, they formed and they die in a certain period. But with the cancerous cells, they do not die. Instead, they keep growing, forming more new of the same cancerous cells. Therefore, that's why you will hear that the cancer cells or the cancer is spreading to other parts of the body. It's because they're no longer dying, but they mutate, they cause duplication of the same cancerous cells. So they say that the mutation tell the cell to grow and multiply out of control, and they don't die. So that's what I just said to you. So these cancer cells, they invade nearby tissues and can break off from a tumor to spread elsewhere in the body. So this, they will develop here. Remember, this is the vagina. The vagina, this is where the penetration of the penis takes place. Then here, this is where the cervix starts. Then this is the uterus, where the child or the fetus or the embryo will develop into fetus. These are ovaries, and these are fallopian tubes, whereby you'll remember from the previous video when I was talking about the ectopic pregnancy. So these are fallopian tube. So now there are types of cervical cancer. Remember that this is where the cancer takes place. I'm more specifically talking of the cervical cancer, not any other cancer, because there are various types, but all of them, they are formed because there is a mutation or there is an abnormal change on the cells, on the healthy cell DNA. So I'll tell you of two types. There is the one which is called squamous cell carcinoma. This type of cervical cancer begins in the thin flat cells which are lining the outer part of the cervix, which projects into the vagina. So this is what they mean here. So this cancer will form here. So I'm not sure if you are able to see this yellow mark I'm making here. So that is where they will start. Then there is also Atino Carcinoma. This type of cervical cancer begins in the column-shaped glandular cells that lines the cervical canal. So this now will be going up within the canal. So within this tube-like part. So there are risk factors. So risk factors are the things that may lead to one to develop this cancer. So the risk factors, one, to have multiple sex partners. That will expose you to have the cervical cancer. Another thing that may lead you to have cervical cancer is an early sexual activity. Having sex at an early age increases your risk of HPV. So HPV, please do Google this. It's HPV. That means human papilloma virus. Whenever you have multiple sex partners and you are having sex early, then that exposes you to have this virus. Then you get it mostly when you sleep with different sexual partners without any barrier method such as a condom. And they say also the other sexual transmitted infections. So I already talked of HPV. So also the chlamydia, gonorrhea, syphilis, HIV, and AIDS, all these exposes you to have the cervical cancer. And the weakened immune system. Smoking also exposes you to have squamous cell cervical cancer. So this will expose you or will make you to develop this cancer. It does not guarantee that you'll definitely have this cancer, but whenever you are engaging in these risk factors I've mentioned, then you stand a chance to develop it. All right, then one will ask, how do I know that I have cervical cancer? You've heard that there is something done in clinics by the doctors in the hospitals that is called Pap smear. Okay, this Pap smear, they actually, this is how it is done, okay? This picture is showing you exactly how the Pap smear is done. This is the first measure to check if a person or if a woman have cancer. One, okay, you will go to the clinic. They will you will ask that you're coming to do the Pap smear, or sometimes the clinics will be running the campaign that they are checking women if they, I mean, the Pap smear. Remember that I told you from the previous slide. This is the cervix. Let me change the color. This is the cervix in red here. So they will, in the clinic or by the healthcare worker or healthcare provider, they will check, they will take a sample here. They use the brush. This is the brush I'm talking about. So they're just going to brush here in your cervix. Then they take this to the laboratory for the pathologist to check if your cells are normal. And when they see that there is an abnormality on the cervical cells, then they will call you and they will ask to do another second step to confirm if it is really the cancer. Then they will thereafter grade it accordingly to say which stage it is. Then when they found that no, there are abnormal cells during the Pap smear, the next procedure that they will do is called colposcopy. It's colposcopy. Here they actually magnify the cervical tissue. They will put something here, then they take the small tissue here, they call that a biopsy, just a small sample of the cells that are affected. Then they will take that to be checked in the laboratory also by the specialized pathologist to see if it is the cancer, so that they can grade it to say that whether it is grade 0, or I mean whether it's stage 0, stage 1, 2, 3, or 4. Okay, so when they confirm that no, actually this is cancer, this is actually cervical cancer. Remember I said the first thing they do in the local clinic, it's Pap smear. The second one, colposcopy. Now, the colposcope will now say, no, actually the cells of this person are cancerous. Then the next thing now that will be done is the other measures, which is you will be called to do some test and procedures that may be used in staging the process. So the first thing, it can either they take you to do CT scan, or maybe you do a PET scan, MRI, or X-ray. You will just be taken so that they will see how far these cancer cells have gone in your body. Did they affect the other parts of the body, or they only affected the cervix, or they also affect the vagina itself? Remember that it's very important to be careful. Remember, I've said that the other cause can be sleeping with multiple sexual partners without a condom, and you may find that you are having this virus. And this virus can live with a person for quite some time without spotting any symptom. Then it means that you can be a carrier of this HPV. And this HPV is not actually the cause, but it may lead to this cancer. So there is stage 0. After they've confirmed with this CT scan or X-ray and all that, they will determine whether it's stage 0, stage 1. After determining whether it's stage 0, stage 1, or stage 2, and so forth, they will then provide the treatment that is relevant to that stage. So which it can be radiation, it can be chemotherapy. So it will depend on them which medication, which treatment is worth doing to stop this. So stage 0 indicates that abnormal cells have been found in the innermost layer of the cervix but are not invasive, meaning that they have not spread to nearby tissues. So in stage 0, the cells, yes, they are they are seemingly cancerous, but they are actually not cancer, but they are pre-cancerous, meaning that they may disappear naturally, or they will become cancer and spread in a nearby normal tissue. So that will also be treated. It's easily treated, that one, because it's just pre, it's not yet invaded other organs or parts of the body. So stage 1, they say it is cancer in the cervix only. So it means that it's only in the cervix. So that is stage 1. Sometimes they will say stage 1A and stage 1B. Then let's go to stage 2. Stage 2 cancer, cervical cancer, has spread beyond the cervix to the tissue around the uterus. So this means that this one has gone inside the uterus. Remember that cervix is the opening between the vagina and the uterus. Remember, the uterus, that is where the baby develop. So it is the mouth between the vagina, that is where your partner's penis enters, and where the baby forms. So whenever you develop this cancer, it will be there. So that means that stage 1, the cancer will only be in the cervix. Stage 2 indicates that cancer has spread beyond cervix, so it went inside the uterus. Stage 3 means the cancer has invaded most of the vagina and possibly the tissue between the hips. So this means that the vagina will now be having cancer, and also the other nearby structures of the body, whereby your hips, they sometimes call it pelvic wall. So you'll start feeling pains around your bottom part or around your hips. Even if you pee, you feel pain. You feel pain during sex. You feeling there will be bleeding now and then that you do not know about. Then there will be stage 4, which is the last stage. They say that this cancer will now be beyond cervix to the vulva, which is the vagina, or urethra, that has the pipe, that's tube for urinating. Remember that the urethra, or the tube for urinating, is nearby the vagina. So this will also affect the bladder, which is the organ that carries urine, the rectum or the anus, and this will also spread to the kidneys and the lungs, liver, the abdomen, intestinal tract. So this cancer is very dangerous. This can extend to many other organs of the body. So it's very, very important to be aware of it. So There will be symptoms, as I explained, that you'll feel the pain when you are urinating, you will feel the pain when you are doing sex, you'll have unexplained discharge that smells. So it is important for one to note all this when it happens. Then please, I advise that everyone do go to clinic and you seek help, and never panic. Just give yourself some time to be explained of this so that you understand and you cooperate with the treatment that the doctor has prescribed for you. Thank you so much, and please like and subscribe to my channel. I appreciate that you have watched this video up to this far. Thank you.